Most people think they know what happens during a medication overdose. Drowsiness, dizziness, maybe nausea, maybe vomiting. But what happened to this teenager was something doctors almost never see. A condition so unusual that only a handful of similar cases have ever been reported. What started as a mental health crisis quickly turned into a medical mystery. And it all began with 9 pills. A 15-year-old boy had been struggling. For over a year, he had been living with depression and obsessive-compulsive disorder, also known as OCD. Let's break that down. Obsessive means unwanted thoughts that keep coming back. Compulsive means repetitive actions performed to reduce anxiety. For some people, these thoughts and behaviors can become overwhelming. To help manage his symptoms, doctors prescribed a medication called sertraline, 100 milligrams each day, a medication millions of people around the world use safely. And for an entire year, everything seemed stable. Everything seemed under control. Until one day, everything changed. The teenager intentionally swallowed 900 milligrams of sertraline, 9 times his usual dose. Doctors call this an overdose, meaning a person takes more medication than the body is designed to handle safely. At first, there were no obvious warning signs, no dramatic collapse, no immediate emergency. But sometimes the most dangerous complications don't arrive right away. They wait. And only hours later, a severe pain suddenly appeared, right in the upper part of his abdomen. Then came nausea, then vomiting. The pain became sharper, more intense, and with every passing hour it became clear that something was very wrong. His family rushed him to the hospital. Doctors immediately began searching for answers. Because severe abdominal pain in a teenager can mean many different things. Appendicitis, gallstones, food poisoning, infection, even trauma. The possibilities were endless. But as the medical team worked through the list, one question lingered. What was causing this sudden and severe reaction? The answer would surprise everyone. Blood tests revealed something alarming. His amylase level was elevated. His lipase level was elevated. Let's break those words down. Amylase and lipase are digestive enzymes. Enzymes are special proteins that help the body perform chemical tasks. The pancreas normally releases these enzymes into the intestines to help digest food. But when the pancreas becomes inflamed, these enzymes leak into the bloodstream. And that's exactly what doctors were seeing. The results suggested that the source of the problem wasn't his stomach. It wasn't his intestines. It was an organ hidden deep inside his abdomen. Then doctors ordered a CT scan. CT stands for computed tomography, a special imaging test that creates detailed pictures of organs inside the body. As the images appeared on the screen, the mystery began to unravel. The scan revealed swelling of the pancreas. Doctors call this edema. Edema simply means swelling caused by excess fluid. And together, the blood tests and scan pointed toward a shocking diagnosis: acute pancreatitis. Let's break that down. Acute means sudden. Pancreas is the organ involved. And itis means inflammation. So pancreatitis literally means inflammation of the pancreas. But this condition is far more dangerous than it sounds, because the pancreas contains powerful digestive enzymes. When the pancreas becomes inflamed, those enzymes can begin damaging the pancreas itself. In a way, the organ starts digesting itself, and that can become life-threatening. For doctors, this was a serious diagnosis. The question now wasn't just what was happening, it was why. Before we continue, if you're enjoying this medical mystery, consider subscribing to Health Casefile. We transform real medical cases into life-saving health awareness stories explained simply. Because understanding disease today could help save a life tomorrow. Now here's where the mystery deepened. Doctors began investigating the usual causes of pancreatitis. Gallstones? None. Alcohol use? None. High calcium? Normal. High triglycerides? Normal. Let's break that term down. Triglycerides are a type of fat found in the blood. Very high triglyceride levels can sometimes trigger pancreatitis, but not in this case. One by one, the common explanations were eliminated. Everything kept coming back normal, and the mystery only grew deeper. So doctors asked a critical question. What changed shortly before the symptoms started? The answer was sitting right in front of them. The overdose. The timing fit perfectly. Symptoms began only hours after taking a massive dose of sertraline, and no other obvious cause could be found. Doctors believed the overdose had triggered the pancreatitis, a rare complication, one that few patients, and even many healthcare professionals, would ever expect to see. Fortunately, this story did not end the way many pancreatitis stories do. The medication was stopped. Doctors gave intravenous fluids, pain medication, careful monitoring. For a time, all they could do was support his body and watch closely. Would the inflammation worsen? Would complications develop? Thankfully, the answer was no. Gradually, the inflammation began to settle. Within days, the teenager improved. The pain eased. The vomiting stopped, and his pancreas began recovering. A frightening medical emergency had been brought under control. What's especially interesting is what happened later. After recovery, doctors restarted sertraline at a much lower prescribed dose, and he remained well. No recurrence, no pancreatitis, no return of the severe symptoms. This raised an important question. Could the reaction have been related to the unusually large overdose rather than the normal therapeutic dose? Researchers believe that possibility deserves further investigation. So how can people protect themselves? First, never take more medication than prescribed. Even medications considered relatively safe can become dangerous in excessive amounts. Second, seek immediate medical help after any overdose. Even if symptoms seem mild, some complications may not appear right away. Third, take abdominal pain seriously, especially if it is severe, persistent, or associated with nausea and vomiting. Your body may be signaling a medical emergency. And finally, mental health crises deserve urgent support. Depression is a medical condition, not a weakness. If you or someone you know is struggling with thoughts of self-harm, seek professional help immediately. Support can save lives. This case teaches a powerful lesson. Sometimes the most dangerous complications are the ones nobody expects. A medication used safely by millions became the trigger for a rare medical emergency. What looked like a straightforward overdose turned into a race to solve a medical mystery. And because doctors acted quickly, a teenager who could have become much sicker made a full recovery. If you learned something from this story, subscribe to Health Casefile. Because every symptom tells a story. Every disease leaves clues. And sometimes, understanding those clues can save a life. Disclaimer. This video is for educational and health awareness purposes only. It is not medical advice. Always consult a qualified healthcare professional regarding medical concerns or treatment decisions.